This video will explore the endocrine system, focusing on the various glands and the hormones they produce. A gland is an organ that secretes particular chemical substances for use in the body or discharge into the surroundings. There are three types of glands: endocrine, exocrine, and heterocrine glands. Exocrine glands secrete their products into ducts. Examples of exocrine glands include sweat, salivary, and mammary glands, as well as the stomach and liver. Endocrine glands secrete their products or hormones directly into the blood rather than through a duct. Examples of endocrine glands are the pituitary, pancreas, thyroid, and adrenal glands. Heterocrine glands, like the pancreas, perform both exocrine and endocrine functions. The endocrine system consists of glands and capillaries that facilitate the diffusion of hormones into the bloodstream. These are often called ductless glands. The endocrine system includes a number of glands: the pituitary, thyroid, parathyroid, adrenal, pancreas, and thymus glands. We begin with the pituitary gland. The pituitary gland consists of the anterior lobe, or adenohypophysis, and the posterior lobe, or neurohypophysis. The anterior lobe produces hormones like growth hormone, prolactin, TSH, ACTH, FSH, and LH. The posterior lobe produces vasopressin and oxytocin. The intermediate lobe produces melanocyte-stimulating hormone. Let's focus on the anterior pituitary hormones. Growth hormone, or GH, stimulates the growth of bones, cartilage, and connective tissue, mediated by somatomedins synthesized in the liver. GH is a protein anabolic hormone. It also affects mineral metabolism by increasing calcium absorption and decreasing the excretion of sodium, potassium, calcium, and phosphorus. Regarding carbohydrate and fat metabolism, GH is diabetogenic, leading to hyperglycemia, and has a catabolic effect, increasing fat mobilization from adipose tissues. GH release is controlled by the hypothalamic hormones, GH-releasing hormone, and GH-inhibiting hormone, also called somatostatin. Stress and exercise can increase GH secretion. Overproduction of GH during adolescence leads to gigantism, characterized by tall stature, bilateral gynecomastia, and large hands and feet. Excessive GH secretion during adulthood causes acromegaly, which results in a broad, thick nose, thickening of the skin, prominent brow, and an elongated mandible, called prognathism. A deficiency of GH secretion results in dwarfism, characterized by shortness of stature, small genitalia, and delicate extremities. Next, let's look at prolactin, another hormone of the anterior pituitary. Prolactin is important for mammary gland development and milk synthesis. Prolactin secretion is stimulated by factors like exercise, emotional stress, pregnancy, and breastfeeding, which act via the prolactin-releasing factor. Inhibitory factors, mainly dopamine, are released by the hypothalamus to suppress prolactin secretion from the anterior pituitary. Thyroid-stimulating hormone, or TSH, stimulates the thyroid gland to produce thyroxine, T4, and triiodothyronine, T3. Adrenocorticotrophic hormone, or ACTH, is secreted by the anterior pituitary, often in response to biological stress. Its main effect is increasing the production and release of corticosteroids. Follicle-stimulating hormone, or FSH, is synthesized and secreted by the anterior pituitary gland and regulates development, growth, pubertal maturation, and reproductive processes. Luteinizing hormone, or LH, is produced by the anterior pituitary. In females, an acute rise in LH triggers ovulation. In males, it stimulates testosterone production. Now we examine the intermediate lobe of the pituitary gland. The intermediate lobe secretes alpha and beta melanocyte-stimulating hormones, or MSH. These hormones stimulate melanin production in skin and hair, and also influence appetite and sexual arousal. Next is the posterior pituitary. The posterior pituitary stores antidiuretic hormone, or ADH, also known as vasopressin, which is synthesized in the hypothalamus. The two primary functions of ADH are to retain water in the body and to constrict blood vessels. A disease related to ADH is diabetes insipidus, characterized by excessive thirst and the excretion of large amounts of severely diluted urine. Another related condition is polyuria, which is the excessive or abnormally large production of urine, defined as at least 2.5 or 3 liters in adults. The second hormone of the posterior pituitary is oxytocin. It is synthesized in the hypothalamus and stored in the posterior lobe of the pituitary gland. Oxytocin stimulates the contraction of the mammary gland to produce milk, and also stimulates the contraction of the smooth muscles of the uterus. We move on to the thyroid gland. The thyroid gland is in the neck, in front of the larynx and trachea. It is butterfly-shaped, weighs about 25 grams, and consists of two lobes joined by a narrow isthmus. The thyroid hormones are triiodothyronine T3 and thyroxine T4. T3 affects almost every physiological process, while T4 controls development and maturation. The thyroid gland also secretes calcitonin, which increases bone calcium and decreases blood calcium levels, opposing the effects of parathyroid hormone. Dysfunction of the thyroid gland can lead to several diseases, starting with simple goiter. Simple goiter is caused by iodine deficiency. It results in swelling of the thyroid gland, which is usually painless. Hypothyroidism results from reduced circulating levels of T3 and T4. Features include goiter, facial puffiness, periorbital swelling, hair loss, ptosis, and dry, rough skin. Hyperthyroidism, or Graves' disease, is caused by increased circulating levels of T3 and T4. Characteristic features are moderate enlargement of the thyroid gland and exophthalmos, or lid retraction.